Buenas noches from beautiful Barrio Huanuca here in Matagalpa, Nicaragua. As many of you know, I'm a U.S. veteran, service-connected disabled, and spent nearly 13 years working in the state of Florida on all things veteran. Employment assistance, job skill assessment, access to VA health care, and advocating for veteran benefits. My buddy Scott Allen Miller has developed several WhatsApp chat groups as an extension of his YouTube video channel about expat living in Nicaragua. I created a veteran expat page on there, and it's starting to fill up quickly. Unfortunately, due to WhatsApp's formatting for chat groups, every time a new member comes on board, they're unable to read the prior threads, so I wind up having to repeat the same information over and over to the nauseum level for the prior people on board. So I decided it's a great time for me to go ahead and dedicate a segment here on Journeys of a Malcontent to my fellow veterans that are moving overseas, particularly here to Nicaragua. Now, before we get to all that, I want to acknowledge all the viewers, subscribers, questions received through this channel. Been on board about 3 months now. I've got 73 subscribers at the time of this shoot, which isn't too shabby considering, this is a niche topic channel and it's 3 months old. So take a moment, please, hit the like button, select subscribe, send a question in, refer a friend, refer an enemy, refer the guy down the street, make a referral. It's all good. And help me feed the YouTube algorithm gods. Housekeeping done. So time to go down the rabbit hole. All right. Throughout the segment, I'm going to be addressing veterans relocating to Nicaragua. Much of this content would apply to veterans moving to other countries, and a lot of it will still apply to veterans that are stateside, but the focus is for expats moving here because I am here in Nicaragua, and this is what I can speak to. I can't necessarily speak what it's like for a veteran expat to move to Australia, for example. So, 10 items and an elephant in the room at the end. Item number 1. If you're a veteran of the U.S. military and you're already enrolled in VA healthcare, yes, you can maintain your VA healthcare enrollment while living overseas. Depending on the exact criteria of your local VA, many of them require you attend an annual physical exam, such as an exam, physical, lab work, chest x-ray, blood work, what have you. If you've not been treated in the VA healthcare system within 24 months by any VA healthcare system, you will more than likely be dropped from rolls. That doesn't mean you've lost access to VA healthcare. It means that you have temporarily been disengaged from the healthcare system. You have to resubmit a new application, and you have to wait in the queue to be assessed to a new doctor. You may not get your original primary care provider. So more often than not, many veterans come back to the States for 3-4 weeks once a year, do all their annual stuff, and go back to the Philippines, Panama, Guam, wherever it is they live. All right, so you can still maintain your health care coverage while living overseas. 2, moving to Nicaragua does not affect your continued receipt of VA compensation. You're going to maintain your banking information stateside. Your money stays in the States. You spend it here. Therefore, that does not affect your tax-exempt disability compensation. That money stays in your bank stateside. You use an ATM or credit cards to spend it here. Number 3, bringing medication with you to Nicaragua. Unless your medication is a Schedule 1, 2, or in some cases a 3, you should have no issue bringing up to 90-day supplies of medication with you on the plane. Obviously, keep it in the original bottles. Don't just have your 2-week, 1-week pill with all the various ones for Monday morning, afternoon, whatever, all rambled together. Keep them in the original bottles. I would encourage, have a copy of the original paper receipt that came in the bag with the medication. Have all that stuff accessible. If for some reason customs has an issue, you've got it available. Now, 90-day supply, if you want to have that medication mailed to you in Nicaragua, from the VA, there is an option for that. We're going to get to that later under the foreign medical program. But shipping 90 days worth with you on the plane, easy peasy. So, bringing number 4 to the light, need to file a new claim while you're in Nicaragua. Yes, you can still file claims from Nicaragua. You're going to do it from your laptop, va.gov, enter the portal, and submit your claim. I'm going to highly encourage you make sure that little lock button and the web page is there to show that you have a secured connection, because you're dealing with a lot of identity theft laden information that people will pay big money for. Your medical information, your social security, the addresses, what your medications are, what your disabilities are, where and when you've been treated. That's a lot of information that has a lot of has a lot of value to unscrupulous people. So, we do not have accredited veteran service officers in Nicaragua, meaning there is no one who is lawfully licensed to file your claims for you in that capacity. As an accredited service officer, it was unlawful for me to accept payment or gratuities to file a claim. Therefore, you should not be paying anyone, stateside or in Nicaragua or any other country, to file your claims for you. Now, if you decide to use a private attorney to file a claim, that's your right and your decision to do so. I am going to highly encourage that you do not utilize a fee-based attorney, with the exception of if you've had a claim denied by the veteran judges. So the claim was denied, you send it to the judge, and the judge denies it. If it needs to go to U.S. District Court of Veterans Claims Appeals, like I did, yes, there are organizations out there which pretty much live in D.C.'s District Court of Veterans Appeals courtrooms that can facilitate those claims. Other than that, most fee-based attorneys now are charging up to 40 and 50% of your back pay. And if you've waited years and had all this anguish to give half of that money away to somebody because they shuffled paperwork that a state or county service officer is already paid and duty sworn to assist you with, why give up that money? So again, there are rare situations, but unfortunately, ever since the Camp Lejeune settlements came up, the PACT Act came out, a lot of fee-based attorneys are going wackadoo with their fees, and it's unpatriotic. Let's leave it at that. All right, moving on to number 5. Should go without saying, if you have any state-level benefits due to your veteran status, whether it's just because you're a veteran, whether you're 100% service-connected disabled, whether you're a Purple Heart recipient, a POW, whatever, any of those benefits, such as free parking, exempt from licenses for hunting, fishing, occupational licenses, discounts on your property taxes, none of that applies outside of your state or the U.S. So none of those benefits and perks transfer with you. You're not going to get free admission to a national park in another country. But the question has come up before, so we're answering it. Number 6, use of a local doctor in Nicaragua. As a tourist, as a national, as a visitor, as a contracted employee, investor, whatever. You have access to no-cost and low-cost health care. And as an expat, you also have the financial potential for fee-based medical assistance here. Many expats in particular will use the private healthcare system of Vivian Pellis. It's a big for-profit hospital in Managua. Politicians, dignitaries, international travelers, expats, veterans in particular, often use this facility. It is highly rated. It has a good percentage of doctors who are bilingual, so if Spanish is a barrier for you at the moment, there are many doctors there that can speak English, or at least enough to get you the information that you need and that they need to relay to you. I myself went to Vivian Pellis to meet the #1 rheumatologist in the country because I had the very important question of my medication being available in Nicaragua or not. It's not information you could find on the internet. My doctors in the VA couldn't tell me what's available in another country. And there's no Nicaraguan website that's going to tell you which medication was available in country. So I went and I had an hour-long consult with the number one rheumatologist, and because I'm that HR personnel guy, I had all my vital VA information saved on my cell phone, easy access. He did a complete file review. He reviewed my immunizations, he reviewed my medications, my problems list, my surgery history, my treatment records, all of my MRI, x-rays, all of it. Did a complete file review. Actually wrote my health certificate in the process of doing this exam. I had a 1-hour consult with the number one rheumatologist of the country, and it cost me $68 US. So, again, I could go to a no-cost doctor and wait in line like the average NICA. I could go to a low-cost add-on service and see a specialist that has a very small base fee, or I can go to the private doctor. Those are all options for you as an expat. So, yes, you have complete access to healthcare here. Number 7, how do I get my VA healthcare records in the hands of a new primary care provider here in Nicaragua? You have complete access to your VA healthcare records online from va.gov. I will highly encourage you spend the time to do a complete download and update on a regular basis. Make files digital, and don't try to just download them all, because you'll get hundreds or thousands of pages in no discernible order of a lot of data that nobody's going to take the time to sort through, and you'll drive yourself crazy trying to figure out which blood work was from what day. Go in there, divide and conquer. Go look at all your radiology exams. Download them and give them a name. Give them the date and left foot x-ray, right foot MRI, right elbow, whatever. And put all your radiology in a file. Go download all your immunizations. Label them by date. If you had to have regular optometry exams, put all your optometry exams in there. You can hand a brand new script for your eye exam and give them to an optometrist here to get new lenses made. Hearing exams, any of that. Go in there and separate the files and make multiple copies for yourself digitally, and leave a digital copy with someone stateside. Whether you put it in a safety deposit box, you leave it with a power of attorney, you leave it with an attorney, you leave it with a family member, a friend, whomever. Leave a copy stateside so you always have that digital backup. Have multiple digital copies with you here in Nicaragua. Number 8. What if the VA needs me to attend a claims and pension exam while I'm in Nicaragua? This is exactly why the VA created a form called the Disability Benefits Questionnaire, also known as a DBQ. Now, there's been a lot of back and forth debate about the appropriate use of the DBQ in the past. The form exists for veterans to facilitate exams when they're away from the VA healthcare system, and active duty personnel. They're on remote assignments that don't have direct access to active duty medical facilities. So as an example, I'm in a far-rung outpost in the eastern side of Germany, and it's a 6 or 8 hour drive to Frankfurt. Here, let me get this disability benefits questionnaire filled out by a trained expert in that field locally. So that's what the intention of the form is for. They have been misutilized in the past. People have gone and found fee-based doctors that will supposedly review your entire VA medical record. My VA medical record is over 5,000 pages. Nobody is sitting down to read all that. I'm also not paying somebody $500 to write me a medical opinion in the process either. It's unscrupulous. But the doctor that you do have fill out a disability benefits questionnaire needs to be that subject matter expert in that field. So you're not going to go to a podiatrist to write an opinion on immune suppression. You're not going to go to a dentist to write an opinion about a foot disorder. So the doctor needs to be fully licensed and credentialed in their country for the specialty area needed to fill out that form. Now, all of that being said, there is still a very real world chance that the VA is going to try to challenge the credentials of your foreign doctor. It's just how it is. To save yourself a lot of agony, if you can fly back to the States to attend a CMP exam, if it means you winning your disability claim or not, I'm going to highly encourage you take the path of least resistance and coordinate a flight back to the States and maybe see family in the process, update a driver's license, update some, maximize your time. Make it even worth more than you originally planned on doing. All right, number 9, so we're getting there. Do I have to have a physical address in Nicaragua for my VA healthcare records? No. They don't need to know exactly where you are living overseas. Even the foreign medical program, you can submit it with just the country you think you're going to be living in, just to get the ball rolling. I put in one 9 months before I moved to Nicaragua and just listed Nicaragua because I didn't know the address yet. And they don't really need to know the exact address either. They just need to know, oh, look, we have a veteran who may potentially be using this service in the future. So you're going to still maintain some address stateside. If for no other reason, then your driver's license still has to have a U.S. address. If you own property stateside, you still have to have some level of ownership listed with that address stateside. Banking, you need a local address stateside. A lot of applications, forms, and submissions, you still need that U.S. address. Your U.S. phone bill, as an example, T-Mobile, you still need that address. So if you're not going to maintain a home in the U.S., but you have a family member, a trusted friend, somebody with power of attorney, an actual attorney, there's actually fee-based companies that will do a virtual address for you, but you need to maintain that address, and you can list that address for VA purposes. So when they send the little card out, even though you tell them, I don't want the card mailed, just send it to me by email, because I get the email, I get the card, I get the text message, I get the virtual alert, I get them all. They're going to still send you that little postcard in the mail. And if you'd like to know why they have so many redundant notifications for appointments, because no matter how many times they tell veterans about their appointments, they run up to a 50% no-show rate for those appointments. So the first guy that's going to complain that he didn't have access to his doctor is the one that threw the postcard in the mail without reading it, doesn't trust the internet, thinks it's all a scam and it's going to go away someday, and ignores all the notifications they get, doesn't answer his phone because it's some scammer in India or whatever. They have all these false misconceptions. Half of those appointments go unfilled. That's a big detriment. And when you want to talk about cost savings in the government, you could start by people attending the appointments they screamed about getting. That would save the government, which means taxpayers, if people just showed up for the appointments they were scheduled for. Off my soapbox. But yeah, you want to maintain some address stateside, so that's the address you would use for the VA. They don't have to have your physical address in Nicaragua. They're not going to be mailing anything to you by USPS to the local courier. All right, number 10. So we're at the biggies. Is the local health care in Nicaragua any good? I heard it's a scary, undeveloped country with violence and poverty. Well, the only part of that statement that's valid is the poverty. This is a poor nation. The poverty is pronounced. It's obvious. It's all getting better. If you've been here before or visited in the past, as time goes on, you see the total quality of improvement of life across the board for the people. So, the poorest of people here still have access to health care. The poorest of people here have equal access to health care to the richest people. But the richest people have additional access and options for fee-based service if they want to. So does that mean only the good doctors go to fee-based? No. They have phenomenal healthcare practice here at no cost and low cost. So just because it's a poor nation doesn't mean people don't have access to good health care. They do. Poor nation, and they have access to low housing costs. They have access to very low cost of food. They have low and no cost education. What they don't have is doctors charging ridiculous amounts of money for services and living on a golf course. They don't have giant inflated insurance company systems with billing bureaucracy that just builds jobs unnecessarily for the sake of creating jobs, processes, and formulas to make things difficult to justify expenses. It's nationalized health care for the most part. It's very streamlined. That eliminates a lot of the costs. So that makes it affordable to have people on board, and doctors not making but barely $1,000 US a month. They're not doing it for their money. They're doing it as a job, but they're doing it because they're ingrained into it and involved into it, not to, do investments on the golf course in between surgeries. That's not the bulk of the healthcare people here. The doctors here are not getting rich off the poorest nation in Central America. The healthcare system isn't getting rich off the blood, sweat, and tears of the poor. Its purpose is to support the poorest of people. So, the largest hospital in Central America is being built here in León, Nicaragua. It's not being built in Guatemala, which is a larger country with a huge city. It's not being built in Honduras. It's not being built in Belize. It's not in El Salvador. It's not even being built in Costa Rica. It's being built here for a reason. So, yes, you have access to good and great health care. The odds are, depending on whether you're looking for a general provider or a specialist, you should be able to find one that meets your needs. Language barrier notwithstanding, that's on us. If you're poor in Spanish, start taking classes now like I'm doing. There is an abundance of dentists in this country, so Nicaragua might be known as the land of lakes and volcanoes, but I refer to it as also the land of Novocaine and dentists. It's a large source of medical tourism here as well. So that's our top 10 questions that I've had asked recently. So now we get to the elephant in the room. What is the Foreign Medical Program? Foreign Medical Program is the VA's program to assist veterans who are not inside the United States borders. The application form, VA Form 10-7959, F as in Foxtrot, -1. Foreign Medical Program, FMP application form. This form will provide select access overseas to VA-approved medical facilities. So if you weren't familiar, the VA does have a handful of facilities outside of the United States. Examples: Philippines, Panama. Panama has been the source of a recent scandal where over 30 doctors were fired due to fraud, overbilling, and collaboration to do so. Forewarned. I knew people that said that, I'll just go down to Panama and I'll get my health care down there, as if I was still stateside. Well, the flight from Managua to Panama is going to cost you as much as the flight from Managua to Miami. So, if you are not utilizing one of the rare select VA-approved healthcare facilities outside the United States, the other side of the coin for the Foreign Medical Program is you may be eligible for full or partial reimbursement of expenses for healthcare services and or medication for your service-connected disabilities. So, note, if you are 100% service-connected, permanent and total, where you have no out-of-pocket medical expenses, you've got no-cost dental with the VA, that's great stateside. Foreign Medical Program for that 100% permanent and total veteran will still only cover those specific issues you have that are service-connected disabled. So unless you have an injury to the mouth, you're not going to have no-cost dental through the Foreign Medical Program. You're going to go find a dentist and pay out of pocket. They will not cover the refrigerated medication. So even if my rheumatoid was service-connected disabled, it's not because the foreign medical program has a defect, it's that it's unlawful to ship internationally refrigerated medication, which is why I have to go back every 3 months to get a handful of auto-injector syringes. So the medications could be covered if they're service-connected. Now, you can request through Foreign Medical Program for medications for service-connected disabilities in excess of the 90-day normal supply. More often than not, that's going to be a 180-day supply, 6 months. They can mail it to your local embassy. They can mail it to an APO, FPO, and most of the time they can mail it to your individual foreign address. Now, depending on how reliable the local postal service is, that may or may not be advisable. So, Foreign Medical Program, hypothetically, I take hydroxyquinine, for my rheumatoid, a pill. Let's say I wasn't flying back to the States and I didn't need to do the refrigerated med, and I just have these pills that are service-connected disabled, and I don't want just 90 days, I want 180 days. I could have those mailed to the U.S. Embassy in Managua in a 6-month interval. I could go down to Managua. I could pick up the medication. Path of least resistance. At least then it's through official U.S. courier. Now, if you want to be reimbursed for those service-connected disabilities, the VA would like, and this would expedite your claim on your behalf, this would behoove you, you need to have the doctor translate the medical notes into official English, and you need to have this foreign doctor submit the billing directly to the VA on your behalf. Let me explain what that would look like. Hi, I'm a podiatrist in Tippy Top of Nicaragua. I don't speak English. I just saw this veteran, and now instead of practicing medicine, I'm supposed to stop what I'm doing. If I want to get paid by your foreign government, I need to stop what I'm doing, and I need to go find a translator to transcribe my medical records that I just wrote into English for this person's country. And then I need to get on the phone and be put on hold internationally by the VA billing department. If any of you have ever tried to contact VA billing, you were not on and off the phone in 20 minutes. You probably weren't off the phone in an hour. So no doctor in another country is going to try to submit billing directly to the Veterans Administration unless they're in those situations where they're working in Panama in a VA facility, unless they're in the Philippines, what have you. So it's going to be on you to go get it translated and for you to mail these to the U.S. out of pocket. And you can send it to them without the translation, but it takes longer. The VA does accept forms in Spanish. It takes longer because then they have to translate it. Even if you have it translated, even if you have all the billing documents collected and you submit it all to them and you send it DHL, UPS, whomever, the average wait time for a reimbursement is 8 to 12 months. 8 to 12 months to get that $68 back in your hand because you went and paid to go see a doctor. Is it really worth all the time and effort to you to go get something translated at roughly $10 a page, to pay for however much in shipping, probably a good $60, to go get $60 back? Probably not. That's why most expats kind of laugh at all this jump through the hoop stuff and say, you know what, you can keep that. Obviously you need the money worse than I do. I'll just pay out of pocket. So that's what most of us will do. Or you go back on a regular interval of once a year, every year and a half, whatever your local VA says to maintain your health care, and you just see them then. I have medications mailed to my sister's house, and I pick them up every 3 months. So for me, that works. That's my path of least resistance. So, If you're still watching after all that, I'm going to say thank you. I want to give you a note about if you're still stateside. I'll encourage you to reach out to your local county, state level service officers for direct assistance. Again, I'm no longer accredited. I can't file on your behalf. I can give you guidance, but if you want somebody to actually file your claims with you, you need to go to a county or state level service officer, because again, they cannot charge you a penny to file your claims. They are already paid to do it. They cannot accept gratuities or tips. So it's their mission to help you. Go get that direct assistance. Go to the National Archives, do a complete download request from them to get well, it'll be on a disc, but get a complete copy of your military medical records, complete copy of your personnel file, unredacted copy of the DD-214. Go reach out to any private doctors you've been to immediately and get whatever records are on file, because those records are being purged at lightning speed anymore. If it's a 5-year-old record, why does it matter to the doctor? It doesn't to him anymore, but it might to you. It may help validate a claim that you have. But compile those things, but go to National Archives for the military records. Go to va.gov to download your current healthcare records. And again, thanks. If you're not a veteran yourself, but you have a family member that's a veteran, you have a friend that's a veteran, you know a guy down the street that's a little goofy but is kind of all right, and you want to see him getting taken care of because you know he's a veteran, please share this information with them. Refer them to a county or state level service officer for help. Tell them, you know, the va.gov, archives.gov websites to get the data they need to document and validate their claims and their healthcare conditions. I did this for a living, had a lot of pride in my work, helping my fellow veterans. Now I'm retired, so I can't file the claims, but I can give advice. And it's a little late right now. It's going on about 9:30 at night. Normally I'd be doing this in the daytime on the rooftop, on the veranda, looking over the valley, sipping on some coffee that was picked about 2 valleys away. But again, thank you all. I'm having a blast doing this 3 months into it, giving a perspective of my time here. And this particular request for a veteran video is right up my alley. I did this for a living, and I've lived it. So 100% service-connected, disabled, permanent total. I still have pending claims. There's a bunch of retroactive money out there. The District Court of Appeals one is being sent back to the VBA successfully. But even successfully, that still might be 18 months to give me the money because the VA doesn't know exactly how to follow the exact instructions written by the district court. And then I have 2 more that have been with the judge that are probably going to be denied. That'll be sent to the District Court of Appeals, which will be another 2 to 3 years. It's a long, drawn-out thing. You need to have some patience with it. But I wanted to give people some insight on the veteran medical program as well. With that, I want to say gracias and adios.